Right, I'm going to be analyzing the sport of running. We are going to be looking specifically at the left side of the body. There are two phases in running, the swing forward phase and swing backward phase, which I will be explaining via picture form, which will be coming up next. Right, the first phase we're going to look at is the swing forward phase. Now, I've identified 6 joints which we're going to be speaking about, which are the neck joints, the shoulder joints, elbows, hips, knees, and ankles. Now, the first one is the neck joint, which is also the cervical joint or the facet joint, which runs from vertebra C3 to C7. As you can see in the picture and in the video, her neck is completely neutral. There's no movement at all that you can see in the video. And the muscles that keep the neck still will be the scalene muscles, the sternocleidomastoid, and the semispinalis. The next joint we're going to look at is the shoulder joint, also known as a glenohumeral joint, which is a ball and socket joint. Now, you can see her shoulder right now is in slight extension, okay, which is due to the deltoid anterior. The antagonist muscle to that would be the deltoid posterior, and you can see that her shoulder at the moment is in slight concentric phase. The next joint will be the elbow, which is a complex hinge joint. Now, as you can see, her elbow is in flexion. Usually that's just because of the momentum from running, but what would actually cause that would be a contraction of the bicep and extension of the tricep, because the tricep is the antagonist muscle to the bicep. Her shoulder, her mm, elbow joint is in concentric phase. The next joint we're looking at is the hip joint. The hip joint is a ball and socket joint, and there is slight lateral rotation when her foot hits the ground. You can observe slight lateral rotation when her leg swings forward and hits the ground. Just directly after that, you would be able to see that movement. The muscles involved for causing that, and this particular picture, would be the glute max and your hip extensors, because you can see the hip is completely extended, and it is now it's now in an eccentric phase. If you look at the knees, the knee joint is a synovial hinge joint. It is in complete extension, which is usually it's due to the contraction of the quadriceps, which will put your leg into extension. But in this case, in the running, it's a little bit hard to say because most of it is due to momentum. But usually it would be caused by the tricep, by the quadriceps, especially on the upward swing phase. Her leg at this moment is in eccentric phase. So now the last joint that we're looking at is the ankle joint, which is a talocrural hinge joint. You can see clearly her foot is in plantar flexion. The muscles used or that causes plantar flexion will be the gastrocnemius, the soleus, peroneus brevis, and peroneus longus. Now, the antagonist muscle to those which cause dorsiflexion is called the tibialis anterior. Her foot at this moment is in concentric phase. The second phase we're going to look at is the swing back phase, using the same 6 joints as we spoke about previously. The first joint, once again, the neck, stays exactly the same. Like I said before, it doesn't move at all. Second joint we're looking at is the shoulder, the glenohumeral joint. You can see the shoulder is in slight retraction. Okay? The muscles used to cause this would be the trapezius, the rhomboids, and the latissimus dorsi. The antagonist muscle to that is the pectoralis major and the posterior and interior serratus. As you can see right now, her arm is in eccentric phase. The next, the elbow joint, is in flexion. However, it is still pulled back, which is caused by the deltoid posterior and the latissimus dorsi. But still, the muscle that will cause her arm to be in flexion will be the bicep, where the antagonist muscle will be the tricep. The next muscle is the hip joints. Now, the hips in this phase are in complete flexion. Once again, there will be a slight medial rotation, but what it causes hip flexion will be the iliopsoas and the quadriceps. So because of that, her hips are now in concentric phase. The second to last joint we're looking at is the knees, and the knee is in flexion, and that is just purely caused by the hamstrings and by the momentum when running. Her leg in this situation is in concentric phase. And the last joint we're looking at is the ankles. That is in flexion due to the tibialis anterior, in dorsiflexion specifically, and is in eccentric phase. Now, the base of support, as you can see in this whole video, would be the length from the left leg to the right leg when running. So it comes further and in closer. And then the center of gravity, because my girlfriend specifically has quite a flat foot landing, the center of gravity would be over the entire foot. The improvements on which he could do is landing on what is known as a foot strike, where you would land on the ball of the foot, which causes much better momentum as you push forward. That could also cause an injury, such as shin splints, and also overdevelopment of the incorrect muscle that you need when running. There's a lot of things that would also influence running, a lot of internal and external factors, such as wind. If you have baggy clothes on, you'll cause a lot of wind resistance, resulting in you being a slower runner. One way also to improve the speed is by training in explosive ways, because it trains your muscles to contract very rapidly, which you will need for each step, each length of your leg during running. Now, I should be clear as well that when analyzing a movement, the opposite side of the body does always have the opposite effect. So in this case, when I'm analyzing a runner, all 6 of the joints that I have discussed have an opposite effect on the right side of the body, because we're analyzing the left side. So on the left side of the body, if the left elbow is in flexion, the right elbow will be in extension, and that's due to contraction of the tricep and relaxation of the bicep. In the knees, if the left knee is in flexion, the right knee will be in extension due to contraction of the quadricep. And in the ankle, if the left ankle is in dorsiflexion, the right ankle will be in plantar flexion. That is due to the contraction of the gastrocnemius, soleus, peroneus longus, peroneus brevis. And then as well with the shoulder, when the shoulder is in flexion, the left shoulder is in flexion, the right shoulder will be in extension because of the contraction of the posterior deltoid fibers and contraction of the rhomboids, trapezius, and the back muscles in general. It will be exactly the same, whereas if you're analyzing the left side and all of those joints are in extension, all the right side joints will be in flexion. It's just how the body works. Everything will be opposite, especially in case of running.